To talk about how desperate and nightmarish the situation in Gaza currently is, we're now joined on News9 Live by Hadeel Qazzaz. She is a Palestinian woman who works with Oxfam and joins us now from the West Bank. Hadeel, first and foremost, thank you very much for joining us at a very difficult time. May I begin by asking you, according to the information that you have, because you are so close to that area, how bad is the situation in Gaza? There are a lot of reports coming in that tell us that it's an absolute nightmare for the Gazans. Tell us, what is the
Yes,
latest you have?
the situation is something that we have never seen, not in Palestine, not in other conflicts that we are aware of. Oxfam colleagues have been working with difficult conflicts all over the world, but all of them agree that this is unforeseen, unprecedented type of situation. Not only because of everything is destroyed in Gaza, all infrastructures, roads, hospitals, schools, homes, the death toll is so high. It's higher than Ukraine war so far. It's higher than any other war that happened in recent years in across the world, around the world. And because of the dire situation and the needs for services, basic services, including water, including food, medication, any kind of basic needs are not there anymore. And people are crying for days now because they don't have access to these basic needs. Soon we will have news about deaths due to lack of water and lack of food, not only because of bombardments.
It is a terrible situation. Would it be correct to say, Hadil, that the real death toll is likely to be much higher than what is being reported? Because we are told that there are many dead bodies that are lying buried under the rubble of collapsed buildings. These are bodies that have not even been counted. Is that correct?
Yes. These things we also hear, but unfortunately, Oxfam had to suspend all its operations in Gaza because all our colleagues and partners are not able to move for their safety. 11 of our colleagues who work in the Gaza Strip are lost their homes or evacuated their homes, and their homes are partially or totally destroyed. Now, the 33 colleagues we have in the Gaza Strip, they are not able to assess or to do any kind of humanitarian work because they themselves are in need of humanitarian assistance. So unfortunately, the news we hear that maybe the death toll will rise for thousands or hundreds, we don't know, but we cannot also verify this because we cannot operate in the region.
I understand what you're saying. Talk to us a little bit in detail about the siege, the total siege, and the impact that it has had, apart from the relentless bombings, which have caused many, many, many deaths. You were talking about how people have no food, water, fuel, electricity. It's a desperate situation, no medicines. Tell us about that. How bad is it?
So this war comes to Gaza Strip, which is already a vulnerable and very poor and very highly populated region, very highly populated region in the occupied Palestinian territories. For 16 years before this war, the Palestinians in the Gaza Strip didn't have access to movement, freedom of movement, to travel, high unemployment rates, high poverty rates. 80% of the population of the Gaza Strip were below poverty line. So it is already a dire situation where electricity was coming to people only 4 hours. People couldn't store food because they don't have money and they don't have electricity. So the situation was already bad. 90% of Gaza water is not suitable for humanitarian for human consumption, even before this war. Now we add to this the challenge that the water bombs, the water network is totally destroyed because of the bombardment. We add to this the fact that the electricity was cut since October 12th. There are few pockets in the Gaza Strip which has either renewable energy like solar panels or generators, but even these are running out of electricity. So people are in total darkness, no access to clean water anymore. There is no possibility to treat even injuries. There were 10,000 injured people in a Shifa hospital alone. One of my cousins got injured because the house next to her was bombarded, and stones and rocks fell on her, and she was badly injured. She went to the Shifa hospital and was treated for first aid only and sent home. For 3 days, she was in coma, and the family had to evacuate her to a safer space. But there is no safe space because even in the south, bombardments continue. Just this morning, next to one place where my sister evacuated to, 28 people died in a house bombardment next to her. And this keeps people feeling that there's no safe space at all. And wherever they go, they are going to die anyway. Whole families were wiped completely, totally from civil records, like the parents, the children, the grandchildren, the grandparents. They die. In one case, 70 from one family evacuated together to one building, and they all died. So it is very,
70?
very
Did you say 70
70,
people of one
7.
family?
Yes, extended family. So the siblings, the married siblings, and their children and grandchildren, they all joined together and evacuated to a place which they thought it would be safer in the south, but their house was bombed and they all died. In another case, 44 people died as well. So it's these scary numbers. It's that makes us feel that, of course, there's no safe space at all. No place is safe in the Gaza Strip at the moment.
Hadeel, can you tell us a little bit about your family? You mentioned a cousin of yours was injured. Before this interview began, you said that your entire family is in Gaza. Are you in touch with them? What condition are
Yeah,
they in?
very hardly in touch because, as I told you, there is no electricity, no phone charges. We have to all the time try to find one person who has a working mobile phone and just get a check-in, a quick check-in of who's there, who is accounted for. It's very, very worrying situation, and it's really something that very hard for us to follow. We didn't sleep for the last 10 days, not here in the West Bank, while also in the Gaza Strip. Some of my family had to move 4 times from one place to another to be in the south of the Gaza Strip, where now they are there for the fourth time. Again, there is also bombardment next to them. So it is very, very difficult for people to feel any kind of safety, let alone the change of weather. It's becoming colder in the Gaza Strip. It's becoming very viruses are spreading. We hear rumors, or don't know if these facts or rumors, but we hear news about chickenpox being spread. There is the COVID, which is we are not out of the COVID the challenge yet, and the COVID challenge is there. So there is also a risk for a spread of COVID because of the crowded houses. There are at least 30 people staying in one room. In one case, I know 30 men, women, children are staying in one room. And the population is constantly pushed to the middle of the south. So it's not only that they are pushed to the south, 1.1 million, which is impossible in any humanitarian imagination. Logistically, it's not possible. They are also pushed to the middle of the south from
So
two
let me
sides.
ask you this, Hadeel. The Israelis have been saying from the beginning that we have warned the residents of Gaza to move to southern Gaza for their safety. They say we are attacking Hamas sites in northern Gaza. Please move to southern Gaza for your safety. The question is, number one, is southern Gaza really safer compared to northern Gaza? And number two, have people really been able to move? What is the ground reality?
Yeah. First of all, it's not safer to go to the south. I was telling you that people who move to the south, they still hear bombardment next to them, and in many cases, there were houses with 28 to 30, 70 people who were killed in the south, not in the north. The south is what's supposed to be the safer area. And second, people couldn't move. Anyway, there was no fuel in Gaza. There was no electricity. I know a friend of mine who her father is diabetic and he has very bad gangrene in his foot. And she decided not to move because where she can go? She cannot carry her father. Another friend of mine, he had two disabled children. He actually had to carry them and walk for a long distance to reach safety. And again, it's not safe at all.
Tell me this, Khadil. There was talk that Israel had agreed to a humanitarian corridor um, out of southern Gaza to allow foreign nationals and Palestinians with dual citizenship to move out through the Rafah crossing in Egypt. Has that come to fruition? What is the reality there?
No, no, it didn't come because it is not true. For 3 days, I have a friend who has an American citizenship, and for 3 days she has been going to the crossing, and they were not allowed to leave. In four occasions, the Israeli occupation bombed Gaza Rafah crossing in four occasions. So. In two occasions, the Egyptian government tried to fix it, and then it was bombarded again. So it's not possible for anyone, and it's very, very dangerous for anyone to be crossing at this time. We hear that there are loads of supplies, food items, and medicine that is available at the Egyptian side of Rafah, but they are not allowed to come in. In two occasions, at least, we heard that they were sent back because the Israelis were saying we will bomb them if they come near the borders. So even if there is an announcement that travel or a humanitarian corridor will open, this doesn't come true.
So
That's
you are
something that
saying
Oxfam.
that even though Israel said they would allow foreigners to move out of southern Gaza through the Rafah crossing, it's not happened because even Rafah crossing is being bombed repeatedly,
Yes, in four different occasions, it has been bombed
four
by
times.
the Israelis. Yes. And what Oxfam is asking for since day one was a ceasefire, at least for to allow for humanitarian aid to come into Gaza. Basic medications, most of the medications in Gaza ran out. At least in one occasion, largest medication storage house was bombed. So for this reason, there is no medical supplies in Gaza whatsoever. People are operating with very basics. We hear that there is no painkillers anymore in the hospitals. So even basic surgeries cannot be done without painkillers or without sedation or any kind of treatment. So yeah, it's a situation. At least that's what we hear on the ground from people. If you are sick, you will die, basically. And all chronic disease are not treated. So cancer patients, heart disease, diabetes, they don't even think about treatment anymore, and the hospitals wouldn't accept them because they are overwhelmed with the number of injuries and the type of injuries that they receive on a daily basis.
Tadil, you're saying that a ceasefire is the only way that lives can be saved, that humanitarian aid can come into Gaza. We've
Yes.
been hearing that Egyptians have been working on this, the US has been working on this behind the scenes, but it doesn't look like Israel is going to agree to a ceasefire anytime soon.
Unfortunately, without a ceasefire, humanitarian actors cannot move. We cannot risk the lives of our staff and partners more than it's risked right now. We need a ceasefire immediately so we can be able to assess needs and to be also able to bring in what is needed in terms of supplies. We are talking about 70,000 residential homes that are totally destroyed with everything in them, including clothing, including bedding, anything that is needed for basic human lives.
You're quite right about that, Kadil. I have no words to describe the horror that you people are going through. And like you said, the international community, you believe, is just standing by and watching. Do you believe, Kadil, that the Palestinian people are being collectively punished for the actions of Hamas?
I believe that human beings in any place in the world deserve the dignity that humanity gives them to have their basic needs, which is food, water, shelter, and safety. And the people of Gaza are struggling with this, and this is not acceptable by any humanitarian standards or international humanitarian law standards. Uh, uh, there is a need for fulfilling these needs, basic needs first, and then anything else can be discussed. But there is a need for this to happen right now, immediately, as soon as possible. It cannot be delayed anymore, or we will risk seeing tens of thousands of lives lost. And this is not acceptable in 2023 for sure.
So tell me, Kadil, what would you want to say to Israel? And what do you want to say to the international community right now?
I want to say Basically, I want to say to the international community that there are human beings, civilians who have nothing to do with anything, are struggling in the Gaza Strip. And these lives should be respected and should be recognized, and their rights to live is basic human right.
And do you think Israel can be convinced to agree to a ceasefire? Or it looks virtually impossible right now?
I can't say anything about that. I mean, uh, it's what I can say is what Oxfam as a humanitarian organization stands for, which is requesting immediate ceasefire and allowing humanitarian aid to flow. That's what we demand for, and that's what we request. As a person who works with a humanitarian organization, what I care for is the human lives and dignity of lives. That's what I care about. I don't want to see children who are the 50% of the Gaza population dying. I don't want to see people who are women and children who are suffering. I don't want to see lives lost without any basically mercy or any care for them. That's what I care for as an Oxfam staff.
Final question, Kadil. You are obviously concerned about all the Palestinian people, but it must be doubly hard knowing that your own family is trapped there, and you said you've hardly managed to keep in touch. How anxiety-inducing is that at a time when you're trying to help others, your own family is trapped there?
It's absolutely very hard. Not only my family, my friends, my colleagues, the people I work with, everyone is trapped. So I care for my family, yes, but also I care for everyone in the Gaza Strip. I think people there who lived, anyone who is below the age of 16 years old, have witnessed 5 wars so far. And this is not fair for any one of them. People who are under 30 years old, they hardly left the Gaza Strip. They hardly found a job or employment, and this was something that has been going for many, many years. What happened now is a result of many years of accumulated oppression and closure and discrimination and impoverment.
Like I've said so many times before, Kadil, it is perhaps difficult for the rest of the world to even imagine the kind of nightmare that the Palestinian people are living right now. Our thoughts and prayers are with all those who are suffering, and everybody wants this war to end at the earliest. We just don't know what it'll take for the war to end. How many more people will need to die before this happens? That is a question that worries each one of us. But Hadeel Qazzaz, thank you so much for your time, for talking to us um, about this very difficult situation. that you find yourself in, that all the Palestinians find themselves in, your own family trapped there, can't be easy. You have our support, and our thoughts and prayers are with all of you. Thank you so much for talking to us.
Thank you. Thank you very much. Appreciate it.